Hey guys, this is Amanda, and I figured YouTube was the easiest way to do this again. I apologize if you see me coming out of the screen like that. I'm just switching the slide just so I can time it with the presentation. So my topic was the inhibition of triglyceride oxidation through niacin supplementation leads to a decreased risk of cardiovascular disease as we age. So cholesterol, CVD, and aging. The Western diet is obviously a huge promoter for dyslipidemia, so increasing LDL and VLDL cholesterol. As we age, HDL cholesterol starts to diminish because of decreases in reverse cholesterol transport. And what that means is that the movement of cholesterol from peripheral tissues back to the liver via the plasma is not working properly as we age. Also, there's increases in absorption of dietary cholesterol, which aids in elevating LDL cholesterol as we age. So, with the addition of plant sterols, omega-3 polyunsaturated fatty acids, soluble fibers, and soy protein, we can actually help to reverse dyslipidemia, but some people are not educated enough on plant protein or plant diets, and they want to find maybe an easier way to help decrease their risk for CVD. So, niacin has actually been shown through these studies that I'm about to show you to be very beneficial in helping to prevent cardiovascular disease. So just a quick overview, niacin is vitamin B3 or nicotinic acid. There's a couple dietary sources we can get niacin from, like poultry, beef, mushrooms, green peas, avocados. Also, there's many enriched foods out there with niacin. It has been used as a treatment for dyslipidemia since 1955. And just a quick quote, niacin is a broad-spectrum lipid-regulating agent, has been shown to exert multiple favorable effects on cholesterol metabolism, including the reduction of total cholesterol, triglycerides, VLDL, LDL, lipoprotein A, and the augmentation of HDL-C. Now, the different doses given and prescribed will actually have different effects on dyslipidemia, as well as the type of niacin that is prescribed. And just quickly, just mechanisms on lipid levels. The acceleration of degradation of ApoB containing lipoproteins and increases in ApoA lipoproteins is what is shown that what niacin does in the body. So there's multiple trials that have showed increases in ApoB degradation, which is VLDL and the LDL cholesterol, and secretion in the hepatocyte cell line HepG2 cells. Also, additional studies found that niacin directly and non-competitively inhibited the activity of hepatocyte DGAT2, which is actually a key enzyme in the final reaction of triglyceride synthesis. And finally, VLDL and LDL decreases due to the inhibition of triglyceride synthesis. So that means that hopefully the risk of cardiovascular disease is now decreased. So different types of niacin, you have immediate release niacin, extended release niacin, and then niacin in combination with the statin drug. So all three options have shown to have lipid altering capabilities, but in different realms. So they all have maybe different mechanisms in the body. So first, extended release niacin. The most common type is niacin, and that's actually FDA approved to treat dyslipidemia. There's a sustained release effect from 8 to 12 hours. And Perry, he did a study with a randomized double-blind placebo-controlled multi-center 24-week trial and used 2,000 milligrams of extended release niacin in combination with 40 milligrams of laropipran, which is just an anti-flushing agent. It's not a statin drug. And they did that versus a placebo group. And at week 12, they actually saw significant results in the reduction of plasma LDL-C cholesterols, 18.4% to be exact, compared with the placebo group that consisted of adults with primary hypercholesterolemia or mixed dyslipidemia. ER niacin versus IR niacin. McKinney did a study that was randomized, double-blind, parallel comparison of IR and ER. And the treatment involved sequential dosing of niacin supplementation through 6 weeks. So 1 week he had 500 milligrams, the next 1,000 milligrams per day, 1,500 milligrams per day, all the way up to 3,000 milligrams per day. Now results showed that the ER niacin did lower LDL cholesterol levels significantly more than iron niacin with doses of 1,500 milligrams or greater. But interestingly enough, iron niacin showed a significant increase in HDL cholesterol compared with ER niacin. So there might be some different mechanisms used in the body with iron niacin versus ER niacin, but both show good results. So niacin combined with statins. Brown did a 3-year double-blind trial with 160 participants with coronary artery disease, low HDL cholesterol, and normal LDL cholesterol levels. Now he assigned the participants to 4 randomly assigned groups. One was simvastatin plus niacin. The second was antioxidants only. Simvastatin, niacin plus antioxidants was a third, and then there was a placebo group. So the results show that there was unaltered mean levels of LDL cholesterol and HDL cholesterol in the antioxidant and placebo groups. Now, simvastatin and niacin group showed a 42% decrease in LDL cholesterol and a 26% increase in HDL cholesterol. And they actually used arteriographic evidence to show the sclerotic plaque in the arteries to see if it was decreasing or not. And it did show measured benefits in the patients with coronary artery disease and low HDL cholesterol levels. And just another quote over here, niacin plus statin shows that modest regression of carotid atherosclerosis is possible in individuals with CVD, CVD risk equivalents, or atherosclerosis. So what this means is that niacin is actually starting to reverse the sclerotic plaque in CVD. I'm sorry, sclerotic plaque in the arteries that will cause CVD. IR niacin, another picture up top, is most common forms of Niacor and Nicolor, and the peak serum levels are seen between 30 to 60 minutes. Vo and Goldberg did a study for 3 years with 185 patients, randomly assigned to 2 groups, and they evaluated IR niacin on LDL, HDL, and triglyceride and LPA levels. The 2 groups was a monotherapy IR niacin group, so just IR niacin, and the second group was combined therapy group, which was a statin plus niacin. And they dosed with about 2,500 milligrams per day. Now this was really interesting to me. Results seem to be dependent upon the initial lipid levels. So for LDL-C, if it was less than 130 milligrams per deciliter, there was no significant difference in either group. But if the initial LDL-C level was greater than 130 milligrams per deciliter, there was a 35% decrease in MTG and a 32% decrease in the CTG group. So it showed that the monotherapy actually had a slightly higher decrease. Now, if HDL cholesterol initially began with 40 milligrams per deciliter or lower, there was a 40% increase in the MTG group versus a 61% increase in the CTG group. So now we're seeing a bigger increase in the combined therapy group. And then just other results showed the triglyceride levels, there was a 48% decrease versus a 54% decrease. And there was a decrease by all patients by 49%. So IR niacin can significantly alter lipid levels, but IR niacin with the statin may have a slight advantage. And just bringing up dosing, typically lipid-lowering agent for niacin would require doses between 1,500 to 3,000 milligrams. So you're not just going to get that just from one piece of enriched food or just one piece of chicken. You're going to have to supplement. And there was a study done that was a meta-analysis and random effects meta-regression of 14 randomized placebo-controlled clinical trials measuring LPA levels. And you can see all the different doses there that each study used. And results showed that the meta-analysis suggested a significant reduction in LPA levels following ER niacin treatment, which was really no surprise. But when they separated the groups from below 2,000 milligrams per day of niacin and above 2,000 milligrams per day of niacin, they showed comparable effects. So there was no significant difference between the 2 doses. There was a slight advantage in using a little bit greater than 2,000 milligrams per day, but again, both showed significant results, so both would be fine for this type of treatment. So niacin supplements, is this the future to decreasing CVD risk as we age? It can be. So the Coronary Drug Project conducted a randomized placebo-controlled secondary prevention trial, and it demonstrated a significant reduction in CVD events in the niacin intervention group compared with a placebo group. And then I just have a second study right there, a systemic review of meta-regression with 11 different clinical trials involved niacin either alone or combined, and it again shows significant reduction in composite endpoints of any cardiovascular disease event and major coronary heart disease event. So basically what this is saying is summing up all the studies that I found, saying that niacin can have a decreasing effect on cardiovascular disease, but studies are still being conducted to see how beneficial it would be. And coming up on the conclusion slide, all of these niacins, IR-ER combinations seem to decrease prevalence in cardiovascular disease as we age. But why even explore niacin supplementation when plant-based diets can help preventing developing cardiovascular disease? Simply put, the aging process works against us. Some might not know it. Some aren't educated enough on how to change their diet. So niacin prescriptions, niacin supplementations are basically an easier way to know that you are decreasing your effect of cardiovascular disease as you age. You just take one supplement a day and you're good to go. Studies and clinical trials are still being conducted on this topic, but again, all point to niacin being beneficial to us. So if you have any questions, please call in or email me. I can call in to you and be ready for questions. Thank you. That sums up the presentation.